the people out there that you can hear us and see us? Anybody gives a good thumbs up? Good. Right. Well, welcome to today's session. I'm Neil Plumridge. I'm BIVDA's Regulatory Affairs Manager. I'm going to do the introductions and then I'm going to disappear because I'm actually at a conference today, and I will hand you over to Kay and the guys and Layla from BIVDA, and more importantly, Antonella, and more importantly, Ivan from MedBoard, who are actually going to present this session today on the Automating Regulatory Intelligence, Post-Market Surveillance and Literature with AI session. They are going to look to take questions, so please feel free to place questions in the Q&A. We do need to remind everybody that we operate under competition law, and that means that, and generally we don't stray into this area in terms of regulatory affairs, but basically there is no ability to discuss anything that could be seen as fixing the market, suppliers, tenders, pricing. And if you want to raise a question about anything in the Q&A, etc., please keep it generic rather than actually referring to a specific product or a specific case scenario. And that means that we don't stray into the competition law area. If anybody has any concerns about that, raise your hand, we can minute it, and if necessary, you can leave the webinar today and protect yourselves and your company accordingly. But as I say, we very rarely, because it's regulatory, stray into this area at all. The guys from MedBoard, I'd like to remind people that if you're not already using MedBoard, we have a collaboration. Ivan's got some further details on this later on, but there is a discount for your first year's membership of MedBoard if you mention that you are a BIVDA member. And at that point, I'm going to hand things over, unless Kay or Layla have anything else.
I think we've got a question from Chidi.
Yep,
Chidi,
okay.
have you got a question? Sorry. Oh, could we let Chidi speak, Layla? I think his mic may be switched off, if that's possible. Chidi, are you happy to type in the chat your question?
Should have mic on now.
Yeah, can you hear me?
Yes, we can. Thank you.
Sorry,
Chidi.
no question. It was I tried to raise my hand up.
Ah, okay. Sorry.
Yeah.
Thank you, Chidi.
Yeah, okay.
Thank you, Layla.
Yeah, so if there's nothing else from Layla or from Kay about how today is going to operate, there's a presentation, some case studies, and then an opportunity for the Q&A at the end, in which point I will hand it over to Ivan to continue his presentation. Thank you very much.
Thank you, Neil.
Thank you very much, Neil, for your nice presentations. Thank you, everybody, for attending today. So I'm here with MedBoard as well, Antonella. So, we are going to go through how you automate regulatory intelligence, PMS, literature with, AI as well, other different type of technologies. So thank you so much for joining. How we're going to structure this is we're going to have like 35 minutes slides, 50 minutes, like showing a bit of case studies as well within the platform, and then we can open the floor as well for any questions in the Q&A. So as well, you can just type any questions anytime, and then we can just go over them at the end of the presentation. So what I would like to start is to give you a bit of an introduction. If you don't know about MedBoard, so we want to give you a bit of introduction, and as well why AI, what is the process, automations like demo as well, and Q&A. So this is the agenda I mentioned just a few minutes ago, few seconds ago, actually. So MedBoard, so we're based in the UK. As I mentioned as well, we support not only like manufacturers, but as well startups, organizations, healthcare providers, authorities, agencies, and consultancies. We are present in more than 5 continents. We have more than 150 organizations that use our platform already. We are all security and privacy certified as well, ISO 27001 and many others. And we always have a strict design control and validations as well within our system. So, from my side, I'm the CEO and founder. I've been in the industry for more than 50 years. So most of these processes, if not all, I've done this myself, manually. When 15 years ago, literature review was probably like 3-4 pages, and like the other specific processes were quite like high level compared what is required today as well. So again, we are very technical. So you have any question as well, you can obviously like type the question, ask the questions, as we will, be able to understand and to provide any answer that you require for the system. So the first thing is we've been growing organically. So we were talking about automation and AI since like 2018, when nobody was talking about how to automate these processes. So we built a lot of knowledge over the last years, and obviously a lot of like customer growth during these years as well. One of the key things as well in terms of automation and AI is how you unify the data, right? So you use automations and AI. What you would like to do is to connect the platform with as many trusted sources as you can, right? So in our platform, what we do is we cover from compliance, regulatory intelligence, clinical literature, vigilance, PMS, work management, regulatory registrations as well, RIMS, and so on. So everything in one platform. The reason is the more structured processes and connected, the more leverage you're going to get from the data that you have control over. So we have a whole data that is connected to integrated solutions and multi-cloud platforms. So this is one of the main reasons, why we are able to talk about this. First, because we cover a lot in terms of the scope. We cover a lot in terms of like solutions, and we've been growing a lot over the last years in terms of supporting our customers, for automation and AI in multiple processes. So again, we cover regulatory and clinical and PMS. We as well cover globally, so in more than 225 countries, in more than 12 regulatory areas, for regulatory databases, as well for market databases, clinical databases, and PMS and vigilance databases. So that combination makes a very powerful database and as well processes for our customers. The second thing I wanted to show you is our platform our ecosystem is very big. So we cover global data, but we cover a lot of AI-powered software apps. One of them is for Reg Intel, another for literature reviews, another for vigilance. But you can see as well that we have reference manager registrations for the RIMS, submissions, and soon we're going to have as well for the technical documentation. So it's a huge ecosystem. And what we're looking is to automate those specific processes and connecting between them as well. So that leverage within the ecosystem can be achieved. The next thing I wanted to start is why we are discussing this, and why when I was, working in a big company or small companies 15 years ago, 10 years ago, no one was discussing this, right? Is because obviously the size and the volume of updates has increased massively. Not only that, obviously the requirements from the notified bodies, from authorities across the globe has increased as well in terms of the evidence that you need to provide. So when we talk about updates, as anyone experienced this, that you start your week, everything is fine. You're going to check all the updates, regulatory updates, all the different type of databases. But then your week starts with, some questions, some audits, some, like extra help that you need to provide within your team. And then those updates never wait for you. So I always do the analogy that the updates for regulatory, clinical, and PMS are like waves. So they don't wait for you. If you look at the sea, they keep coming. They are not waiting for you if you are on holidays or you have an important audit or you have a specific project that you need to deliver. So you and your team are receiving continuously those waves of updates. So the next thing is, so how do we quantify this? Is this true, Ivan? So how do you quantify this? So this is data that we take from our databases, right? We're talking here about MedTech, global authorities news, clinical trials news, technical standards, pharma, and so on. So you can see since 2015, the increase in volume in terms of the updates has increased massively, right? And if you need to multiply or you cover in different regulatory areas, standards in multiple countries and sources, this obviously increases in terms of the scope that you need to cover. So obviously there is a trend, or at least there is something that we can see is a jump from 2015 around to where we are right now. So has obviously increased a lot. So one of the key things I always ask, for regulatory intelligence literature is how many regulations and guidance are you in compliance with? So if you are able to provide that answer straight away, it's because you are on top. If you can tell me as well how many actions being implemented related to PMS, regulatory intelligence, or literature, then you are on top, right? So the problem and the challenge in most of the times here is to keep it always this process like running and up to date. So this is why we are here as well. Why and what solutions we can provide. Remember as well that regulatory intelligence, literature reviews, and PMS are systematic review processes. So it doesn't matter, what the data or what data we review, the process is essentially the same. We need something that is systematic, active, continuous, consistent, and repeatable. So that process obviously is very structured within companies. The next thing that we need to address is, what are the main challenges to do this all the time, systematically, active, continuous, consistent, and repeatable? First is the manual work. So obviously any manual work involved, especially if it's repeated, if it's tedious. I always joke that when I have to do PMS or literature searches, the first time was very exciting. The second time a bit less. The third time a bit less. But when I have to do this like 10 or 20 or 30 times, there was nothing exciting around it. So obviously our goal is to remove those challenges in terms of like removing those no added value tasks, to the professionals, and moving as well the manual work or the work more to decision making and those tasks where professionals feel more valued and useful. And the other key challenges for companies right now is the isolated and disconnected processes. If you get the information in one location, if you review the information in another location, if you have the task in another track in an Excel, another location, you still need someone to do that manual transfer between those processes. And that creates the same challenge, that you need somebody to do that transfer of information or to keep that continuously. So if we don't have everything within one process that is continuously up to date or speaking to each system, you're going to have the same challenges. The process is going to stop. And one clear example, for regulatory intelligence or literature is gathering those updates, in an automated way, just searching every month or every quarter, and you need to have that collection in one place, gather that information, clean all that information, and then transfer that to another place in order to review it. And that obviously creates a lot of fatigue, for professionals, but as well in terms of delays to have a real-time, regulatory intelligence, literature, or PMS. So what are the key elements as well for these regulatory processes? So the first thing is you need access to global data, whether you're doing PMS, vigilance, regulatory intelligence, or literature. You need to have a process to manage those reviews in a continuous process, especially with changes and updates. You need to manage actions, so any actions, implementations, reports that you need to produce after that. And as well, you need to have another location in terms of or another process to how you manage the data after is completed that process or that review, where you list all the regulations, all the standards you comply with, all the different type of articles that are related to you in terms of compliance, vigilance, and so on. So you need obviously locations. And across all those 4 steps, obviously you need a decision making in terms of human knowledge, experience, ethics, and training that can apply that across, the whole different type of processes. And if you have a plus, is you can report all of this in real time. That will give you an incredible power in terms of reporting, but as well understanding how well you are doing within that process and identify opportunities and risk much faster as well. But obviously we have all these 4 processes. You've seen the challenges in terms of how many updates we have right now, how is the increase. So the question is, if we want to do this continuously and effective, and we don't want to have one person just doing all of this manually all the time, how in a process can we build this with manual work? And the answer to this is it's impossible to do this. And we've seen this in a lot of companies, and even myself, when I was doing this 15 years ago, you start with a very excited, you need to check 50 websites, but after a few months, obviously there's nothing exciting about checking different type of websites continuously for just a retrieval, step. So the first answer is it's impossible to do this with manual work. And as well, most of the professionals that we know, they don't want to use their time to do copy and pasting and doing manual work. And the second question that we need to ask is, where do we want to use automation AI? Do we want to use automation AI in the decision making or to help in the management of reviews and actions and so on. So these are the questions that we're going to cover as well within this webinar. The next question I want to address is what people think automation and AI does for them in terms of regulatory intelligence, or literature or PMS. So obviously, when we talk about these processes within our industry, those are specifically like very complex processes that require like some planning, some execution, and some reporting, right? So I think that we are getting better in terms of like understanding the limitations of automation and AI, but this is the classic, situation that we have encountered in the past. Is someone saying, "Can I just click one button and get magically the literature review report automatically?" So this is the expectation. You have one click, and then you create some kind of magic, and it's going to tell you what to do, what are the tasks, a specific, analysis depending on your context and so on. Obviously, this doesn't work like this. So obviously, what is important for you is to have those processes and to use AI along the way to have different verification checks that will help you in the process. So if we look into more detail with the process, is if you're using, I'm putting this example for reg intelligence, literature, and PMS, but essentially you have a funnel of updates, and then you need to review it based on your appraisal and criteria, and then you need to do a report, actions, implementation, then data repository. So what we see in this diagram is we have 5 steps, the 5 steps or elements that I covered before. So for example, being aware about the regulatory update, the global data, the literature, and so on, you need to paste, clean, organize in a repository and a database, right? So that step can be fully automated, by a solution like us. So you don't need to worry about doing that, all the time. And any changes in websites, we can address that, from our team. So the first thing that you need to have, obviously, is a defined process. And, luckily, the defined process for Reg Intel, systematic reviews for literature and PMS are very, very similar. So you have the same elements. Again, you get the information, you do an appraisal, you do the actions and reports, and then you pass into a data repository the outcome. And all of them, they require a decision making. So as you can see in this diagram, the closer you get as well to the actions and to the decision making, the more customized obviously is to the context of the organization. And we will address that a bit later as well, related to how different professionals can make different decisions with the same data, and still is fine. So obviously, in terms of the automation and AI opportunities, the more we look onto the left side, the more opportunities that we have, especially in terms of like standardizing or fully automating the processes. Why? Because obviously the triage, appraisal, and impact assessment, that can be obviously like customized based on the appraisal forms, the action and reports and implementation. They will require some inputs from the subject matter experts or understanding the context of the organization, and understanding as well the context reality of that decision as well, which is very important. So the first thing that obviously we need to address with all of this is that we need a process to establish process or define process to do all of these steps. So it's not like one click and then it does all the steps. And after these steps is where you need the safeguards as well in terms of verifying the information. Whether you use AI or no AI, you need obviously to verify the output that it's fine to go to the next step, for using that as an input as well. So the next thing I want to address, everybody is looking for this. So this is what we build as well in MedBoard, is then you can have a full end-to-end integrated regulatory intelligence operations in terms of like literature, PMS, and other processes. So from searching the information, assessment, to have the up-to-date and compliant information in just one place. So it's just connecting those processes is what is going to give the leverage, especially in the next years when the technology and the process are going to be much more mature. So I would like to address a bit of AI as well. So when we talk about AI and when we talk about automations, it's very important to as well define what is automation in this context. And the automation means the use of the software to perform tasks without human intervention. And that's very clear that, in some processes, you may require just data engineering, other data science, and other we just need a bit of more AI. There are different AIs as well that we'll cover in more detail in a second. So the first thing that we want to address is for automation, you can actually do a lot of like great automation just using data engineering processes and other techniques that are not, like AI or generative AI and so on. So it's very important to keep this diagram because most of the, these days, people are looking always for AI to solve all the problems. And the solution should be slightly different. We should look at the problem and then we should see what technology or what specific process is going to solve that problem much better. So if we look into a bit of more detail in terms of AI and AI considerations, I want to make some differentiations between like classic software engineering, AI machine learning, like the classic one, and Gen AI. And the difference is how you can control the outputs. And this is a huge consideration in terms of when to use AI, when to use automations as well within those processes. Remember that we work in a regulated environment. So we want to have all those processes like traceable, like they have an audit trail, and then we want to have, we want to ensure that those steps, or at the end of each step, the information is correct to move to the next one. So software engineering obviously is defined by input, output, by code, is validated with test, and everything is measurable, testable, and optimized. And that's very clear. That's the most, used over the last years. AI machine learning obviously uses traditional machine learnings, and the models produce deterministic outputs, which are very important because then you can ensure that are within a specific metrics that you can define what it means to be reliable, and as well how you can validate those specific outputs. So they work more in the structure, numeric, and categorical data. And as well, we have the LLMs. So that is a category of generative AI that, on the other hand, they are trained on the next. They are trained primarily on text to predict the next token, and the LLMs are stochastic, meaning that they are probabilistic. So obviously, the outputs can be more varied in terms of like how you put the input as well. And normally those are validated by with people, human judgment and perception as well. So this is a very important consideration to make, especially when we talk about AI. And I will cover this a little bit more in the decision making. Now, if we talk about those steps that I showed you before, for accessing global data, get updates in real time, obviously the AI can help very much. So you can have automation AI doing crawling, translations, formatting, classification, cleaning. So removing a lot of work that you don't want to actually do, in terms of the very tedious and repeatable as well, especially the cleaning. So obviously for updates, what is important is to have the processes where you are linking to all the databases, literature, PMS, countries, regulatory updates, and create those review processes, right, that they are going to fit into that step. And obviously for the correct information, what it is, it's important to have obviously direct access to the latest information, especially in this industry where things are moving much faster than before. That's super important because that can help you in decision making, in an audit, or in a specific review process that you want to have that up to the latest requirements or standards. And as well into the data retrieval, and that's something that I want to highlight, is very important to understand whether you are looking for precision or you are looking for understanding. So you're looking for precision. Let's say you are looking for doing a search of regulatory updates for 5 countries. What you need to use is a database. So you need to use software engineering in order to extract all the items that are related to that search. The same as you will do with literature. So you will use a database in order to look the precision, in order to get all the hits that you need for that specific query. If you look for understanding, then you can use an LLM and so on. But what it's going to do is going to get the most relevant and then fabricate or create an answer based on those. So it's a huge differentiation. And then you need to question as well, like for a specific task, what you're looking in terms of precision understanding. So if I'm looking for having a summary of the PMS requirements in Europe or in the UK, I may ask for an LLM. If I'm looking for all the updates that happen in Europe between now and 1 year ago or 6 months ago, I will look for a database specific output. So that's a big differentiation, especially to make in the access into the global data. The Other important part in terms of the systematic reviews is the impact assessments, actions, and change management. So obviously what it means to your organization and reviewing, obviously those items, this can be like fully customized as well, for your case. The AI can as well suggest, based on their context, and I will show you some examples later, what are the possible answers and so on. Obviously, depending on, how much context or, how much information requires the AI, obviously you're going to need to intervene, or you need to provide your input as well in there. But a lot of like management reviews and managed work, or as well producing reporting. So, for example, like we are going to release actually this week a new function for the AI to produce a report of your literature review, as well for Reg Intel or vigilance report. So that's going to draft a report already, and then you can verify the information after it's been generated. And then the other important part that we've seen as well is the data and information internal repositories, right? You need sources of truth that always kept up to date. So even if you use automation, AI, and so on, this is very key for future automations. This is key for future inputs for any processes you have as well in there. One of the key things that we recommend as well is to have a dashboard, because one of the important things to digitalize processes is you can have instant KPIs. And this is super important, not only for the processes, for compliance, for auditing as well, but as well for top management. So they understand the value of the task that the team or the specific department are doing. So you can measure as well in terms of the performance, the task as well that you are performing. So I want to just cover as well in terms of decision making, and this is as well a bit more critical, for us, because in terms of decision making and working regulatory affairs, a small action, obviously, or a small mistake can mean something like very big in terms of like consequences. So when we talk about LLMs and so on, obviously they tend to be quite agreeing, with the user, and this is something to take in consideration as well. Like any misinterpretation, any specific wrong interpretation as well of the input of the output can have different consequences. So the question here is, why do we use, how do we use AI in terms of like decision making? I'm not talking about importing the information, cleaning the information. I'm talking here about only decision making. And what I learned for more than 15 years ago, especially working in regulatory, that is highly interpretative, so far to the date, 20th of January 2026, is applying skills and knowledge in real world requires a lot of judgment, context, and high understanding. And is very dependent as well on interpretation. I'm pretty sure a few of you had your product perfectly classified in a specific country, and then you went to the authority and say, no, actually, even if it says that, we want to do it in this way because we think it's the best way, and so on. So not everything that is written in the guidance actually is how things work. And the more you look, or you go beyond the MDSAP countries or the high regulated countries, the more you experience this as well. So one of the key things as well is to understand is obviously regulatory logical. I've been very long in the industry. I think some things are logical, other things obviously they have some kind of lack of logical, especially with the same regulations. They make completely different decisions, right? So obviously as a physicist, I'm trying to understand more the logic, if you produce always the same results. So one of the key things that we want to highlight in automation and AI is you need to differentiate what are database decisions and knowledge-based decisions. This is super important. So you cannot automate every single steps as well. So you need to understand whether the inputs are logical, but you need to understand as well, and we all need to understand that two people can interpret the same information the same, or two people can perceive the risk differently, So we can obviously with the same information, and this happened during COVID, we all had the same hazardous situation, the same risk, but different countries, they acted completely different in terms of how to approach it. So this is obviously where the interpretation and the terms of the responsibility and so on is used. So especially for AI, suggestion is always to use AI as an input in your decision making, but as well the professional needs regulatory literacy. Right, so it needs to understand what it's doing, and this is very key as well for anyone using any new technology. Now, GenAI, for example, in decision making, is already supporting accelerating processes as an input. So we have a lot of examples in our platform that is accelerating. We have a great feedback. Obviously, like people saying, like, is making their process much faster. They can use the inputs. They have less fatigue. I always say, like, you need to review 50 articles. Obviously, you need to extract, in each article, the pico values, the number of patients. After 5, 6, 7, you have a fatigue. But obviously, the AI is not getting that fatigue. So it's going to extract that straight away, and then you can evaluate. And obviously, it's much easier to evaluate an output than to start from scratch. So obviously, it just helps as well, to professionals to have more energy and to focus on what is important. So we can see some examples here for analysis or automated translations, documents comparators, semantic search, or extracting regulatory requirements from documents. So one of the key things that we see as well, it makes you faster if you have the regulatory knowledge or the clinical. When I say like clinical literature, you obviously need to have regulatory knowledge to understand what is the regulatory processes that you are doing. So this is one of the key things that we want to emphasize is not everybody can drive AI or automations if you don't know your process. So education and knowledge of the processes are highly important. The final automation and AI conclusions that I want to make is, especially with a defined process that you can do a lot with, software engineering and automation, is the process have a defined input and a defined output, and that does not require human intervention. And then you can validate it, and obviously you can then rely continuously on that specific step. That's for like a classical engineering. You can do that, but as well you can do as well with machine learning. You can connect the steps and data process automatically when you can. Not every process can be digitized or automated. For example, what should we do in this situation? You shouldn't obviously automate in a specific high-risk situation for a regulatory decision. And obviously having ready-to-use reporting and KPIs are super important in order to report the advantages and as well to report as well the progress of those processes. And more in detail about artificial intelligence and GenAI is to use specifically those that are not validated, use that as an input rather than automation, to use enterprise grade solutions. So you have obviously assurance over confidentiality and privacy. The output needs to be verified by the user. And what is important from vendors like us is to provide explainable AI. So you understand where that information is coming, through citations, highlighting references, and so on. So the user interface is highly important in these processes. And the other thing that I want to highlight as well, as many of you like, I'm pretty sure you've been in these situations that sometimes in regulatory you need to make decisions that they are like overlapping with moral and ethics, and the AI doesn't know what is right and what is wrong, or the full intent and context. So obviously having the human intervention here is very, very, very important. And as well, not use this as a magic wand, but as a tool that can help you to accelerate. So what I would like to finish is with 2 slides. One of them is to how do we measure the impact of automation and AI. So first we do a quantitative metrics and then qualitative metrics. Quantitative are the classic, whether you can do faster processes, reduce manual work, improve the quality and consistency, and as well improve the job satisfaction. This is the metric I'm most proud of, because if we can improve the job satisfaction, is definitely we are affecting people in a very positive way. And as well, we monitor qualitative metrics, whether you are more satisfied, you are less overwhelmed, stimulated, and obviously you have more control and better reporting and communication. This is part from a survey that we did last year. So this together with obviously the other specific benefits, is what it makes us, like to continue and to keep automating those specific processes that we are working. So just to summarize before I show you some use cases, is in terms of the AI and automation. So the first thing that you need to have is trusted data and information, how you get those updates. If you cannot get those updates automatically, obviously your system is isolated, is not moving. And obviously where we're looking or where we're moving in terms of that technology is not only, like having a generation of, reporting articles and so on, is that it's a moving system, it's an active system. So all the time gets all those updates, the review can be done, the triage, and obviously the other task in terms of like generating the review and reporting or the data repository. So you need to ensure that the trusted data and information is continuously coming, but as well is good in terms of like high quality, trusted, and structured. And a lot of work that we do in our platform is to structure the data so it's ready for you. And obviously, the authorities or the different databases are not thinking, to structure the data, as the other 100 countries, so you can have a better life. So obviously, that's a big part of the AI and automation. The process. So if you have a Reg Intel or systematic review process, for literature, for PMS, it doesn't really matter. You have a systematic review process. You need to divide the steps and concur, and then you can fully automate the specific task and verify between the task, the output. That's the huge benefit. While keeping control, you're going to accelerate very much as well that process. For us, what is important in terms of the linking to the previous step is the automations and artificial intelligence. What they can do for you is to accelerate your processes, and this is what is going to happen over the next years. Is the acceleration of that process, but as well the control is going to be much higher than what it is today as well. And obviously it has some risk, so it requires information verification and it requires literacy as well. So one of the key things obviously for companies to address is in terms of like the risk, literacy, and as well which steps or which information from AI we get as well from those systems. And the most important for me and for us is the regulatory professionals, whether you're doing PMS, vigilance, risk management, you're doing like Reg Intel, you are in the driving seat for decision making. So the regulatory professional is the important actor, and the process must work for the professional. So the professional always decides, has human oversight, and obviously has some sign off, electronic signatures and so on. So this is the important conclusions for us. Obviously the automation can be achieved in many different ways. I'm going to show you some examples right now, and then we will offer as well like some time for questions and answers. So I hope you enjoy the presentation. I want to show you like some examples for Reg Intel or literature and so on, so you can see as well the benefits. If you have any questions, you can put in the chat, and then the team will address those. So I just want to cover a few examples. So obviously everybody knows about the specific chats that are out there. So obviously the first classic use of AI is just to retrieve information, right? So I have an example here for a specifics for a registration in Brazil. So it's just a retrieval, it's a RAG, it's obviously getting this information from all the latest information and regulatory. So again, the speed of gathering this information has been transformative. If I compare in my career like 10, 15 years ago, when you have to look into those specific countries, regulations, so you couldn't get answers straight away. This is very useful as well in doing audits or understanding specific requirements, also understanding whether the auditor is asking the right question, not asking the right questions, so we have a very good feedback about this. The next one I want to cover is more in the processes, because what I'm more interested in specifically in this webinar is about those processes. So if you have for example, a Reg Intel, so in our case, in our platform, you can monitor from MedTech, environmental, chemical, so you can see a lot of even standards. So if you had defined the specific searches on which countries you are searching, getting all the updates. So in this case, I have Australia, Brazil, Canada, that for that they range. And then you have defined as well in your appraisal criteria. Remember those steps, how you're gonna define the information. So does it impact my QMS? Does it impact my product registrations? You can define as well for example, for AI, you can automate this, but you can further automate to give context in our system as well. It can be connected, for products information, range systems as well. So the automation or the full integration will be obviously very, very advantageous for the users. And then you can look into, for example, I'm going to look into any update, for example, for this. And then you will be able to see the update. So again, all this automation, sometimes, like what we get the feedback for literature, PMS, and Reg Intel is the small things are the big things. So it's always in life, the small things. So just having all the updates here already, organized with the PDF side by side, ready for you to review, is already like giving you a lot of time back, and removing as well all the tasks that you don't want to do. So we have the assistant that you can ask any question. You can see as well, it just gives you already like a potential. You can ask questions. And then you have defined those questions, and I said this is relevant, you can assign to some persons that review. But what I wanted to show you is you can ask the AI as well, to provide a specific feedback. So you can have as well feedback and then it will give you as well citations within the specific document. If you don't have a PDF as well, you will see it in the same way. So I can go to the same one, and then you can just provide as well those specific updates in here. So what we're seeing as well is obviously we have the AI, you can extract a lot of information in here. Is as well, this AI will read the link. That's what it's able to read or to understand the feedback. Is you will have obviously some suggestions. So you can either use the suggestion or you can modify the suggestion or not use the suggestion. And this is one of the key things that where we're seeing the advantage is not only in retrieval of the information, but as well having all this information in one place that you can extract the information anytime as well. If you have one use case is the translation. So you have original and this is translated automatically by AI. Then, this is obviously saving you a lot of time, and then you can review the information straight away. So you can see a lot of different use cases, for especially in the Reg Intel process, especially you have all the updates, you can retrieve the information. I want to show you as well for literature. So it works in the same way. You can extract information. We have an AI screener that based on the answers, it can predict whether it's going to be included or not included. Obviously, you remain with the final decision. And then when you have the final articles in here, so I can just use, for example, this one or this one. Then you can as well give the context and then provide, ask the AI to provide the answer as well. So I have my article in here, and then it will provide where that is specific. So if I define what is this my specific device, it will highlight whether it's mentioned already and whether it's used for the same medical device. So again, you will verify this information. You can as well go in here and just check, from where it's getting that information. But it's just accelerating the process massively. So you can see this works as well. You can just create as well data extraction tables and generate that as well. I can ask the assistants, and then can I get a table with the key results of the article. So you can as well ask the chat directly to generate tables as well based on that. So you can fully customize based on the answers. So this is what is obviously these small steps is what accelerating a lot. So you can do the same for regulatory. You can do obviously the same for literature, and I have as well for vigilance as well in here. So in the same way, if you have a PDF and then you have your vigilance, you can ask the AI assistant extract information, or you can standardize as well based on the questions. You can as well ask the AI as well in those processes. So when we look in the systematic review process that I mentioned before, you can see that the steps are all the same. So you need to have a setup that this has to be highly controlled by yourself. So you need to obviously, I always say the intelligence is always in the question. So it's having a great plan. It depends very much on the knowledge and as well the experience of that professional, that team. So creating the appraisal criteria, the searches, but as well, all the review process, the actions, and the reporting. In our system as well, you can get all the reporting for literature, for regulatory intelligence straight away, with the Prisma and a few other databases. And as I said, this Thursday, we're releasing an AI reporting. So based on the answers and how you extracted the information, it's going to create already a draft report that is going to discuss the results for Reg Inter, for literature, for vigilance, or for market, surveillance as well. So obviously those steps you can see as well, our process is helping the professionals, the teams along the way. It's not replacing them. obviously, when you have metrics that were mentioned before, is you are able to produce those metrics. Sometimes what we get as well, the simple automations as filtering just the results with the actual device is giving them, a lot of value that it doesn't obviously require, AI to provide value for every single need as well. So this covers for these use cases. What I wanted to cover as well is if you go, we go to the compliance manager. This is what I was mentioned before, like every company should have a list of all the regulations, all the standards that apply to them. But there are many use cases that you can use as well in terms of for example, if I look for MDCG that I have in my list, we monitor. So again, you don't want to be monitoring whether it's active or active, is withdrawn, whether it's been replaced. We track all of that. We tell you all the previous versions. But what you can do in, for example, in here, we have different AI functions that can help you to, for example, extract regulatory requirements or compare to other previous version, or, for example, to combine, with other PDFs and ask questions. This is, again, just accelerating your process, getting the information much faster, and it's up to you, obviously, to make those interpretations and so on. But, that I hope you see as well, how we approach in terms of it's not one click, and it's like SpongeBob, it will say like magic. This is like step by step, and then you can verify the output after each step, and then use the AI for the next step, so that continuously can accelerate, massively the process. So I think we have 13 minutes, for left. So what I would like to do, obviously, to open, the floor for any question. I'm sure that we cover any question. I can show you more specific functions for AI. I want to just to give you an overview of, the acceleration that we were talking before in terms of the how we use in our processes. The other thing I want to say is we use AI internally as well to clean the information before you get, the information. And that's a very important step that you don't see. It's invisible, but that's a task that you don't need to do. And what we believe is in the future. What we believe as well, the AI reporting, as I mentioned before, the technical documentation module that is going to be released now in February. So it will help you as well to automate the generation of reports, of draft reports, and technical documentation and so on. So our goal is to connect all those processes where the professionals keep control and keep the direction of all the regulatory information within the system. So thank you so much for the time. I hope you enjoyed. Just to remind you as well, like we have a BIVDA obviously agreement. We work very closely with BIVDA, and if you subscribe to MedBoard, you get a discount as well with us. So we're happy to have that collaboration, and BIVDA as well, promoting the automation and digitalization, and as well encouraging new technologies within companies that eventually make lives of the companies, but as well the life of professionals much better as well. So let's open the questions, and happy to answer any question, myself, Antonella in the chat. So yeah, thank you so much.
Thank you so much, Ivan, for that amazingly comprehensive overview of your system. Thank you very much. We have had a question in from Tom. You recently posted on LinkedIn a red line of the proposed IVDR changes. Is a red line change a built-in function for all reg standard updates?
So that specific document, it has been done by my team. So not used by AI automatically. If you know the two documents, I don't think AI will understand what to replace or what to add in one place to another, because they are highly difficult to actually to read and to mix. And there are some typos as well. So again, this is one example that obviously my team used AI to accelerate the process. But at the same time, that was done more like, verified manually, and as well, formatted manually and so on. So that's a classic example that I don't see today with the technology that we have just to fully automate it, especially because, Tom, we want to give a very good red line without any mistake or typo. So, that's for us well to have that quality. We have a AI comparison that compares previous versions of standards and documents. So yeah, we have that, but not like for that specific example, we don't have that, like for IVDR, especially when there are like more than one, 2, 3 documents that are involved in the creation of the red line. We are working as well for a red line as well, more direct in terms of like what has changed and what has not changed, that we will release very, very soon as well in there. But that's more detecting, in terms of like characters removed, added, and again, it just depends very much on the interpretation of the person.
Thank you, Ivan. Another question's come in from Mark. Can you give an idea of costs? But he appreciates that it might be difficult to answer, given that it might be a tailored solution for depending on the needs of the person.
Yeah, so what I can share is we have a starter package that includes all the data, all that you see in there, plus, like different allowance. And depending on the size of the organization, you have different tiers as well. So I think the best thing, what we can say is we have a 99% retention. We have as well, in terms of like price point, very accessible, because what we want to do as well is to help a lot of small companies, medium-sized companies that maybe don't have the ability to use these tools day to day. And I think that's one of the key successes, for us, that we are benefiting for that. So we are helping them to benefit from this technology. So what I would say, Mark, is you can contact us. We can understand the context and the size of the organization. We can provide that very easily. But what I would say, we have an accessible pricing that is at tier level. So some companies, they have hundreds and hundreds of users. Others, they have up to 5, or that is our entry point.
Thank you very much, Ivan. Thank you. I've got a question actually, and I apologise if I've missed it in your presentation. But once you find all of this information and these reports and everything, can you actually store them within the system, or are they exported and stored in a different platform?
So once that, for example, in this case for literature reviews, so once that you decide that some articles are relevant, and this is one of the key things to have one ecosystem. You say you have these 8 that are relevant. You can export them either in Excel, in a Word document, in a regular report, or you can transfer them directly to the reference manager. So we have those databases, for us, that we have. The databases that we have is Compliance Manager to list all the regulations and standards you're in compliance with. In terms of the articles, the Reference Manager. So I can come in here and I have my list of all the articles, the same as I have the regulations. So I can open this and I can say, okay, this is the article and this has been reviewed by MedBoard admin that day, and this is the systematic. So everything is traceable. And then in terms of the information that we have as well for market list, and companies can as well have all the products, which is very linking all together, right? At the end, you just want to have a process that is low linking together. And then you can link that to a specific product. So I can understand this product. We have a UDI management, but if I link any standards or any literature, I will see that straight away in here. So our system allows as well for these solutions that we have with the data management to have as well you can link in the impact assessment for Reg Intel to say it's affecting this specific certificate or this operator or this specific submission and so on. So you have everything connected in here. One of the key things that I want to highlight as well in terms of like audit trail and traceability. And this is super important because when we had this situation where companies there were asked by the auditor in terms of when you review that specific guidance or regulations and why was not applicable to you. So then companies have obviously they can go to their reviews and everything is audit trail. So I can go, to this specific item. So for example, this one. And then I can go to the history and I can see that it was pending, on October 2025. And then I put no relevant, and then I give a reason as well. So traceability and connection is very important as well across the systems because, again, if everything is talking to the other data sets, and as well from this specific article when it was reviewed by whom, or for example, I know this article is been used it's been relevant in 2 of them, So then I will have more traceability over what is being reviewed by whom, So the same for regulatory.
Perfect. Thank you. Thank you, Ivan. Are there any more questions before we close? We've got a couple of minutes left to go. If anyone's got any questions, people can either contact Yvonne and Antonella directly or through us at BIVDA, no problem at all. And we will share the slides with everybody that's attended today as appropriate. If that's okay with you, Yvonne and Antonella. Yeah, perfect. Yeah. Thank you. Thank you very much.
I feel like Tom has a question, so I can answer that one. Can you cover a little bit more?
Sorry, Tom, I missed it.
About coverage of instrumentation, machinery regulation, laser standards for lab instruments. Would these areas be covered? Yes, we cover machinery, everything. So we cover all these regulatory areas. So you can look for any country, any okay, so you will have for radio frequency, environmental. So they are like located in different areas. We are increasing another 4 areas in the next 6 months as well. So we are ever growing as well, the coverage that we have. And then if I look for machinery, so if I look for the machinery, I will be able to search as well in a normal search as well. For authorities news, I will be able to search for specific regulations. And sometimes a simple search like this, it just gives you a lot of automation. The automation that we do on our side is to keep this always up to date. So if something is published 1 hour ago, we have this already in our search for you to search. So yeah, we cover that, Tom. And in terms of the standards, yeah, we cover, I think, more than 100,000 standards. So we cover from different technical groups, not only the related to medical, IVDs, and so on, but as well in a broader field as well. Does reference manager the brand or any reference manager? If I understand correctly, Boris, the reference, so this is our reference manager. So this is, there are other reference managers out there like, EndNote and so on. This is our own brand reference managers. This is something we built ourselves. We have a citation manager. And one of the key advantages is everything is under the ISO 27001 umbrella. So everything is secure and is connected through, this system that is obviously through MedBoard that approves supplier, all the security certifications and so on. So, our reference manager is our own brand reference manager that has different functionalities, including the AI and more AI that functions that we are going to create as well, as you will be able to create reports or analysis, using multiple PDFs at the same time. So I'm saying like this will be shared as well within this month. So I hope that answered your question, Boris.
Thank you. Perfect timing, I think, Ivan, now. So if there's no other questions, I'd like to thank you both again for joining us today. And we look forward to seeing you at the Regulatory Affairs Seminar in a couple of weeks' time in Birmingham. So thank you both. And thank you, everyone. Okay. Thank you, everyone, for joining us today.